Morning, ma'am. I am Nicole Morales from Apcas Medical Hospital. I am the nurse in charge for today and I will be interviewing you. The purpose of this interview is to obtain baseline data that will be used in your record.
Before we start, may I ask what your name mother po, ilang taon na po sila? Meron po bang significant health problems? Meron po bang babae po wala? Nag-exercise po. Nalakad. Diet, nagda-diet. Ilang beses po sa isang araw? Mataas po bang medyo lang. What do you think? Nagkakaroon. Ilang beses po sa isang araw po ito ba nagkakape? Umiinom po ba kayo ng alak? Cigarette, pero nasa sa inyo po. Na-try niyo ba ito? Personal sa inyo. Yung mga nakakarang araw. Meron po ba yung nutrition or weight loss? Ito yung mga nakakarang araw po. Nakakaranas po kayo. Dahil po karanasan ko. Paano po kayo nag-focus sa health? Sa friends mo? Sino po yung mga support system? Kaya, ba kayo nagkakaroon?
Introduce yourself and verify the client identity. Provide the client privacy. Perform hand hygiene. Check the temperature. Check the client pulse rate and respiratory rate. Check the client height. Check the client weight. Check the client blood pressure. Document the findings. And don't forget to say thank you.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Discuss how the results will be used in planning further care or treatments. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client's privacy. Observe for signs of distress in posture or facial expression. Observe general body build, height, and weight. Observe client's posture and gait, standing, sitting, and walking. Observe client's overall hygiene and grooming. Note body and breath odor. Note obvious signs of health or illness, for example in skin color or breathing. Assess the client's attitude, frame of mind. Note the client's affect and mood. Assess the appropriateness of the client's responses. Listen for quantity of speech, amount and pace, quality, loudness, clarity, inflection. Listen for relevance and organization of thoughts. Document findings in the client record. The patient is relaxed, erect posture, and coordinated movement. The client is clean and neat. The client has no body odor or minor body odor. Also, the client is cooperative, able to follow instructions. The client has sense of reality.
In order to perform the assessment, introduce self and verify client's identity using agency protocol. Discuss how the result will be used in further planning care or treatment. Good morning, ma'am. My name is Kira Pineda. I'm your nurse for today. So I'm here po to assess your skin, hair, and nails. It's okay po ba sa inyo if hawakan ko yung certain parts nyo? Perform hand hygiene and observe other infection prevention procedure. Provide for client privacy. Inquire if the client has any history of the following: pain or itching, presence and spread of lesion, bruises, abrasion, pigmented spot, previous experience with the skin problems, associated clinical sign, family history, presence of problems in other family members, related systemic condition, use of medication, lotion, home remedies. So let's proceed na po sa assessment. First is inspect the skin color. Best assess under natural lights on areas not exposed to the sun. Next is inspect the uniformity of skin color. Assess edema if present, location, color, temperature, shape, and degree to which the skin remains indented or pitted when pressed by a finger.
Measuring the circumference of the extremity with a millimeter tape may be useful for future comparison. Observe and palpate skin moisture and temperature. Compare the 2 feet and the 2 hands using the back of your fingers. Note skin turgor, fullness or elasticity by lifting and pinching the skin on extremity or on the sternum. Ask the client about the products and equipment that usually uses on their hair. Perform hand hygiene. Inspect the evenness of growth over the scalp. Inspect the hair thickness or thinness. Inspect the hair texture and oiliness. Note presence of infection or infestation by parting the hair in several areas, checking behind the ears and along the hairline at the neck. Inspect amount of body hair. Remove and discard the gloves and perform hand hygiene. So now let's proceed to the nails. Mom, do you have diabetes mellitus or previous injury or severe illness? Inspect fingernail blade shape to determine its curvature and angle. Inspect the fingernail and toenail texture and bed color. Inspect tissue surrounding nails. Perform blanch test of capillary repeal. Press the nail bed between your thumb and index finger. Look for blanching and return of pink color to nail bed. Perform at least one nail on each hand and put So, ma'am, yung skin color niya po is varies from light to deep brown. And generally uniform except in the areas exposed to the sun. No signs of edema and some birthmarks. Then, moisture in skin and axillae. Then, uniform yung temperature within a normal range. When pinched, skin spring back to previous state. Is elastic. And sa hair nyo po is evenly distributed and thick hair, silky and resilient. No sign of infection or infestation. So, in your nails naman is, ang shape niya is convex curvature and ang texture niya is smooth, highly vascular and pink in light, and then intact yung epidermis. And prompt return of pink or usual color when I press the nail bed. So, it is all normal. So, ma'am, yun lamang po. Thank you for cooperation.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the result will be used in planning for further care or treatments. Good morning, ma'am. I am Nicole Morales from Abcas Medical Hospital, and I am the nurse in charge for today, and I will be assessing your skull and face. Before we start po, I will be touching some parts of your skull and face. So, is that okay with you, ma'am? So, yung information po na ma-obtain ko during this assessment will be strictly confidential between you and me and the physician that I will refer you to. To participate po, sundan nyo lang po yung mga sasabihin ko po sa inyo, ma'am. Okay? Perform hand hygiene and observe other appropriate infection procedure. Provide for client privacy. Inquire if the client has any history of the following. Ma'am, meron po ba kayong problems with lumps or bumps? Itching, scaling, or dandruffs? Wala naman po. Inspect the skull for size, shape, and symmetry. Inspect the facial features, example given, symmetry of structures, and of distribution of hair. Inspect the eyes for edema or hollowness. Note symmetry of facial movements. Ask the client to elevate the eyebrows, frown, or lower the eyebrows, close the eye tightly, puff the cheek, and smile, and show teeth. Document the findings in the client record using printed or electronic forms of checklists supplemented by narrative notes when appropriate. Upon observing po, sa inyong skull, rounded or normocephalic naman po ang inyong skull, symmetric with frontal, parietal, and occipital prominences naman po, smooth din ang skull contour. Sa facial features niyo naman po, symmetric or slightly asymmetric facial features naman po. Palpebral fissures are equal in size din naman po, at ang inyong nasolabial folds naman po ay symmetric. Sa eyes naman po, wala naman pong edema or hollowness. Sa facial movements naman po, symmetric naman po ang facial movements.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain what you are going to do, why it is necessary, and how to participate. Discuss how the results will be used in planning further care or treatments. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Inquire if the client has any history of the following: family history of diabetes, hypertension, blood dyscrasia, or eye disease, injury, or surgery. Client's last visit to a provider who specifically assessed the eyes. Current use of eye medication, use of contact lenses or eyeglasses, hygienic practices for corrective lenses, current symptoms of eye problems. Use this opportunity to reinforce proper eye care and need for regular vision testing. Inspect the eyebrows for hair distribution and alignment, and skin quality and movement. Inspect the eyelashes for evenness of distribution and direction of curl. Inspect the eyelids for surface characteristics, position in relation to the cornea, ability to blink, and frequency of blinking. Inspect the bulbar conjunctiva for color texture and the presence of lesions. Inspect the cornea for clarity and texture. Ask the client to look straight ahead, hold the pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. Inspect the pupils for color, shape, and symmetry of size. Pupil charts are available in some agencies. Assess each pupil's direct and consensual reaction to light to determine the function of the third and fourth cranial nerves. Assess each pupil's reaction to accommodation. Assess peripheral visual fields to determine function of the retina and neuronal visual pathways to the brain and second cranial nerve. Assess six oculomotor movements to determine eye alignment and coordination. If the client can read, assess near vision by providing adequate lighting, and ask the client to read from a magazine or newspaper held at a 36 centimeter If the client normally wears corrective lenses, the glasses or lenses should be worn during the test. The document must be in a language the client can read. Assess distance vision by asking the client to wear corrective lenses unless they are used for reading only. Document findings in the client's record using printed or electronic forms or checklists, supplemented by narrative notes when appropriate.
Prior to perform the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Discuss how the results will be used in planning further care treatments. Good morning, ma'am. I'm your student nurse for today, and I will be assessing your age and hearing. May I know your name po? Ano ba? Oo nga. Ay. Di ba ano ka? Ano, pwede ka ba yan?
Sige, good morning, ma'am.
Sige, sige. Good morning, ma'am. I am your student. My name is Sam Surelo Teclaro, your student at Sport po, and I'm glad to see you please and hearing. May I know your name po, ma'am?
Kira Pinanape.
Your age po,
18 po.
your birthday po,
October 2, 2006.
and perform, managing, and observe other infection prevention procedures. Provide for client privacy. Inquire the client as a history of the following. Meron po ba kayong family history of hearing problem or loss po?
Wala naman.
Exposure to loud noises at home or work?
Low po.
Nag-take po ba kayo ng mga medications? Especially if there are complaints of ringing in the ears like tinnitus.
Wala naman.
Ayan po, magpuproceed na po tayo sa procedures. Inspect the auricle for color, symmetry of size, and position. Ayan. Ano po, tagin na po kayo. Your auricle naman po is aligned in your outer campus of the eye, and your skin po is same as patient skin. Palpate the auricle for texture, elasticity, and areas of tenderness. Yan. Gently pull the auricle upward, downward, and upward. Hold the pinna forward, shift the coil, and push it to the tragus, and apply pressure on the muscle process. Upward. Mobile firm and no tenderness. Inspect the external ear canal for cerements, skin lesion, pus, and blood. Yan, tingnan lang po kami. Ayun po. questions naman po siya. Perform whisper test. Pwede po bang pakita-kit ang isang tenga? At pakiulit na lang po ang aking mga babanggitin. The weather is hot today.
The weather is hot today.
Sa kabila naman po.
Baka po.
Okay naman po. Pwede na po ang stick. Able phrase to repeat corrected. Yan na. Proceed naman po tayo sa test. Mali po ba? And this sound is heard in both ears. And proceed po tayo sa Renee test. Conduct the Renee test to compare air conduction to bone conduction. Ako sabi na lang po pag wala na po kanya na naramdaman. Ano po kaya? Kabila naman po. Sige pala kasi
Stop. Stop.
Ayan po.
Opo.
Air conducted is greater than bone conduction. Document findings in the land record using printed or electronic forms or checklist supplemented by narrative notes when appropriate. The oracle naman po is mobile firm and no tenderness when update. So the result naman po is all normal and wala na po ba kayong map? Nagdagan ba tayo naman? Sige po. Salamat po sa pakipag-cooperate.
Prior to perform the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the results will be used in planning further care or treatments. So, good day po sir. So, my name is Jacob Bulokan po and I am your nurse for today. So, what we're going to do po is I'll be assessing your nose and sinuses po for us to be able to inform if there is some abnormalities po. So, in assessing po, it's expected po na mahawakan po natin yung ilong nose po natin. So, let's say external nose po. So, may I have your permission to touch it po? So, is it okay po, sir?
Okay na po.
Okay po. So, before we start po, let me verify you first. So, what's your name, sir?
Sancho del Auditaro.
How old are you po?
18.
When is your birthday po?
August 23, 2006.
Okay, so first is let me perform hand hygiene first. Perform hand hygiene and observe other appropriate infection prevention procedure. Okay, the next is provide privacy. May injuries po ba kayo sa nose, external nose? Wala naman po. Okay, may medications po ba kayo na changes into smell po?
Wala naman.
Wala naman po. So, we're done with the question. So, the next is position the client comfortably seated in position. Okay, so let's start with the assessment po. So the first is inspect the external nose for any deviation in shape, size or color, and flaring or discharge from the nerves. So sir, tingin po kayo dito. Okay po, so I observed that the patient's nose is symmetric and straight po. No discharge or flaring uniform color. So the next is lightly palpate the external nose to determine any areas of tenderness, masses, or displacements of bone and cartilage. Okay po sir, let me have your permission po ulit. So okay lang po ba ang hawakan? Okay lang po. So, I observed that the patient's nose is not tender and no lesions po. So the next is determine patency of both nasal cavities. Ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. Repeat the procedure to assess patency of the opposite nares po. So, So, sir po, tatakpan ko po yung isa and mag-breathe po kayo. Okay po. Okay, so sa kabila naman po. Okay. So, I observed that the patient's breathing po is air moves freely as clients breathe through the nares po. Okay. Observe for the presence of redness, swelling, growths, and discharges po. Okay, so I observed that the patient's internal nose is mucosa pink po, clear, and watery discharge po, and no lesions. So the next is inspect the nasal septum between the nasal chambers. Okay, sir. Tingnan po kayo. Okay, so I observed that the patient's nose is nasal septum intact po and in the midline. Okay, so the next is palpate the maxillary and frontal sinuses for tenderness po. Okay, so I observed that the patient's maxillary and frontal po is not tender naman po. Okay, so next is document findings in the client record using printed or electronic forms to checklist supplemented by narrative notes and appropriate. Okay, so lahat naman po na in-inspect and observation po natin is normal. Symmetric naman po yung nose po natin and not tender po or no lesions. Tapos yung sa breathing naman po is okay naman po siya, air moves freely po, and the mucosa po is pink and clear watery discharge po. So, and also hindi naman po siya tender. And all in all po is normal naman po. So, do you have any questions pa po? Wala po. Okay, so kung wala na po, dito na po nagtatapos yung ating assessment po. So, thank you for your participation po, sir.
Hi sir, good morning. My name is Nicolette Ivona Sindaya and I'm gonna be your nurse for today. Today I'm gonna assessing the mouth and the oropharynx. Prior to performing the assessment, Introduce self and verify the client's identity using agency protocol. Explain to the client what are you going to do, why it's necessary, and how to participate. Discuss how the result will be used in planning further care or treatments. Lahat po na mapag-uusapan natin at sasabihin nyo ay mananatiling pribado sa akin sa inyo as a doktor na i-refer ko. Perform hand hygiene and observe other appropriate infection prevention procedure. Clean gloves, tongue depressor, 2x2 gauze pad, pen light. Provide for client privacy. Inquire if the client has any history of the following: routine pattern of dental care, last visit to dentist, length of time, ulcer or other lesions have been present, denture discomfort, medications client is receiving. Position the client comfortably, seated if possible. Inspect the outer lips for symmetry of contour, color, and texture. Ask the client to purse the lips as if to whistle. Normal findings: the patient has uniform pink color, soft, moist, smooth texture, symmetry of contour, ability to purse the lips. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and presence of lesion. Normal findings: the patient has uniform pink color, moist, smooth, soft, glistening, and elastic texture. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to open the mouth using a tongue depressor, retract the cheek. View the surface buccal mucosa from top to bottom and back to front. Repeat the procedure for the other side. Examining the back teeth for proper vision of the molars using the index fingers of both hands to retract the cheek. Ask the client to relax the lips and first close, then open the jaw. Observe the number of teeth, tooth color, the state of fillings, dental caries, and tartar along the base of the teeth. Inspect the gums, observe for bleeding, color retraction, edema, and lesion. Normal findings: 32 adult teeth, smooth white shiny tooth enamel, pink gums, moist, firm, texture to gums, no retraction of gums. Inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, nothing in particular broken or worn areas. Examine the gums beneath the dentures for sore areas. Smooth, intact denture. Inspect the surface of the tongue for position, color, and texture. Ask the client to extend the tongue. Patient has central position, pink color, moist, slightly rough, thin, wrist coating, smooth lateral margins, no lesion, raised punctile. Inspect tongue movement. Ask the client to roll the tongue upward and move it from side to side. Patient moves freely, no tenderness. Inspect the base of the tongue, the mouth floor, and the frenulum. Ask the client to place the tip of the tongue against the roof of the mouth. The patient has smooth tongue base with prominent veins. Inspect the hard and soft palate for color, shape, texture, and the presence of body prominences. Ask the client to open the mouth wide and tilt the head back, then depress tongue with a tongue depressor as necessary, and use a pen light for appropriate visualization. The patient has light pink, smooth, soft palate, lighter pink, hard palate, more irregular texture. Inspect the uvula for position and mobility while examining the palates. To observe the uvula, ask the client to say "ah" so that the soft palates rise. Position in the midline of soft palate, rise during vocalization. Inspect the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gag response. To expose one side of the oropharynx, press a tongue depressor against the tongue on the same side about halfway back while the client tilts the head back and opens the mouth wide. Use a pen light for illumination if needed. The client has pink and smooth posterior wall. Inspect the tonsils for color, discharge, and size. The patient has pink and smooth, no discharge, of normal size or not visible. Remove and discharge gloves. Perform hand hygiene. That's all for today, sir. If you have any concern and question, you can tell me po. Thank you for your cooperation po.
Prior to performing the assessment, introduce self and verify the client identity using agency protocol. Explain to the client what you are going to do, why it is necessary and how to participate. Discuss how the result will be used in planning further care or treatment. Good day, ma'am. My name is Grace Angie Santa Maria. I will be your student nurse for today. For classification lang po, ma'am, what is your name? Mary Rose Panliza? Okay po. How about naman po your age? Oh, 19 po. Your birthday po, August 7, 2005. Okay. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Inquire if the
Inspect the neck muscle for abnormal swelling or masses. Ask the client to hold and head erect.
observe head movement. Ask client to bend the chin to the chest. Bend the head back so that the chin point. Tilt the head so that the air is moved toward the shoulder on each side. Turn the head to the right and to the left. Assist muscle strength. Ask the client to turn the head to one side against the resistance of your hand. Repeat with the other side. Ask the client to shrug the shoulders against the resistance of your hand.
Palpate the entire neck for enlarged lymph nodes.
Palpate the trachea for lateral deviation. Place your inspect the thyroid gland. For our findings naman po ma'am, it's all normal. Muscle equal in size, head center, coordinated, smooth movement with no discomfort, head flexes 45 degree, head hyperextend 60 degree, head laterally flexes 40 degree, head laterally rotates 70 degree, equal strength, not
Prior to performing the assessment, introduce steps and verify the client identities using agency protocols. Explain to the client what are you going to do, why it necessary, and how to participate. Discuss how the result will be used in planning further care and treatment. So today, I will be assessing your thorax and lungs if there have any problems or abnormal findings. This assessment is confidential for you and me and the other medical teams, and this will be used in planning, treatment, and care in the future. Next is ask the client name, age, and birthday for the identity of the client. What is your name, ma'am? Your age, and your birthday po. Perform hand hygiene and observe other appropriate infection prevention procedures. So now I will be performing hand hygiene. Provide for client privacy. For females, drape the anterior thorax when it not being examined. So I will be close the curtain. Inquire if the client have any history of the following. Family history of illness, including cancer, allergies, tuberculosis, and lifestyle habits such as smoking and occupational hazards. Example is inhaling fumes. Next is medication been taken. Current problems like swelling, cough, wheezing, pain. According to the client, there have no family history or problems. So now we'll be proceed in posterior thorax. Inspect the shape and symmetry of the thorax from the posterior and lateral views. Compare the antero-posterior diameter to the transverse diameter. So, I will be inspecting the posterior and the lateral views if it is symmetric. So next is inspect the spinal alignment for deformities if the client can stand from a lateral position. Observe the three normal curvatures, the cervical, thoracic, and lumbar. To assess for lateral deviation of spine, observe the standing client from the rear. Have the client bend forward at the waist and observe from behind. So I will be inspecting the alignment. Next is palpate the posterior thorax. Assess the temperature and integrity of the chest skin. For the client to have respiratory complaints, palpate all thorax areas for bulges, tenderness, or abnormal movements. Avoid deep palpation for painful areas, especially if a fractured ribs is suspected. In such a case, deep palpation could lead to displacement of the bone fragments against the lungs. And this is, I will be checking the temperature of the skin and palpate the thorax if there have tenderness or abnormal movements. Palpate the posterior thorax for thoracic expansion. Place the palms of both your hand over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to deep breath while you observe the movement of your hand and any lag-in movements. Palpate the thorax for premitus. The faintly perceptible vibration felt through the chest wall when the client speaks. Place the palmar surface of your fingertips or the ulnar aspect of your hand or close the piece of the posterior thorax. Ask the client to repeat such as phrase as blue moon. Compare the premitus on both lungs and between the apex and the base of each lungs. Next is percuss the thorax. Percussion of the thorax is performed to determine whether underlying lung tissue is filled with air, liquid, or solid materials, and to determine the position and boundaries of certain organs. Ask the client to bend the head and pull the arm forward across the chest. Percuss in the intercostal space at about 5 cm, intervals in systematic sequence. Percuss the lateral thorax every few inches, starting the axilla and working down to the 8 ribs. Auscultate the thorax using the flat disc diaphragm of the stethoscope. Use the systematic zigzag procedures used in percussion. Ask the client to take slow, deep breaths through the mouth. Listen at each point to the breath sounds during a complete inspiration and expiration. Compare the findings at each point with the corresponding point on the opposite side of the thorax. So now, we will proceed in the anterior thorax. First is inspect breathing patterns. Example is respiratory rate and rhythm. Second is inspect the costal angle. Angle formed by the intersection of the costal margins and the angle at which the ribs enter the spine. To palpate the anterior thorax, the other nurse will be palpate this.
Palpate the anterior thorax. Palpate the anterior thorax for respiratory expansion. Place the palm of both your hands on the lower thorax with your fingers laterally along the lower rib cage and your thumbs along the costal margin. Ask the client to take a deep breath while you observe the movement of your hands. Palpate for tactile fremitus in the same manner as for posterior thorax using the sequence. If the breasts are large and cannot be retracted adequately for palpation, this part of examination is usually omitted. Percuss the anterior thorax systematically. Begin above the clavicles in the supraclavicular space and proceed down to the diaphragm. Compare the lung on one side to the lung on the other side. Displace female breast to facilitate percussion of the lungs. Auscultate the trachea. Auscultate the anterior thorax. Beginning over the bronchi between the sternum and the clavicles.
The finding of the assessment of the patient is the anterior posterior to transverse diameter in ratio of 1 to 2. Thorax is symmetric. The spine is vertically aligned. Spinal column is straight. Right and left shoulder and hips are the same height. Marine skin intact. Yung temperature is uniform. Chest wall intact. And no tenderness nung nagpalpate and no masses din po. The expansion naman po is full and symmetric thorax and expansion. And yung the fremitus is bilateral symmetry of fremitus. Nung percussion naman po is the percussion note resonance except over the scapula. The auscultate the thorax is vestibulo and bronchovestibular breath sounds. The breathing patterns naman po is quiet, rhythmic, and effortless respiration. The costal angle is less than 90 degrees, and the anterior thorax is no tenderness and masses, and also the respiration expansion is full symmetric expansion. Tactile fremitus is bilateral symmetry of fremitus. Percussion note resonate. Brachial or tubular breath sounds. Bronchovesicular and vesicular breath sounds. This is the all findings.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what we are going to do, why is it necessary, and how to participate. Discuss the results as being used in further care care planning or treatments. So, good day, sir. My name is Jacob Golokan and I'm your student nurse for today. So, what we're going to do right now is to assess assessing the breast and axillary po. So, for us to be, we're going to assess breast and axillary po for us to be able to know if there's abnormalities, also for us to be able to inform. And so, before we start, let me verify you first po. So, what's your name, sir?
Sam Cirelo Gataro.
When is your birthday po?
August 20, 2006.
The next is, let me perform hand hygiene first po. Also provide privacy. Okay, so the next is inquire if the client has any history of following. So sir, nagkaroon na po ba kayo ng, or meron na po ba kayong pain or tenderness sa breast ninyo?
Wala naman po.
Wala naman po. So, nagte-take po ba kayo ng medication history like yung oral contraceptives,
Wala po.
yung steroids po,
Hindi.
yung digitalis?
Hindi po.
Then, let's proceed to the assessment po. So, the first is inspect the breast for size symmetry. Okay, so, pulat po kayo na maayos. So I observed that the patient's breast, even with the chest wall, is obvious, may be similar in shape to female breast po. So the next is I'll be inspecting the skin of the breast for localized discoloration or hyperpigmentation po. So I observed that the patient's skin is skin uniform in color po, similar to skin abdomen if not that po. Okay, so the next po is emphasize any retraction by having the client po. Gayahin niyo po ako. Gawin niyo po. Tapos, yung chest niyo po yung the next is so I observe po na wala naman po siya retraction. Okay, so ang next po natin is to inspect the areola and nipples for size, shape, and symmetry and color po. Okay, so I observe that the patient's nipples and areola is symmetry and it's from naman po. Yeah, so the next is I'll be palpating your axillary po, or let's say yung subclavicular and supraclavicular lymph nodes po. So let's start po. I observed that the patients, when I palpate the axillary and subclavicular and supraclavicular po, wala naman po siyang tenderness or masses or nodules po. So the next is, I'll be palpating the breast for masses, tenderness, and discharge from the nipples po. Sir, po kayo maayos. And I observed din po that the patient has no tenderness, also masses po, nodules, or nipple discharge po. So the next is I'll be palpating the areola and nipples for masses po. So I also observed that there are no tenderness, masses, nodules, and nipple discharge po. Okay, so overall naman po is normal. Yung breast nyo naman po is symmetry and yung color naman po is normal po. Tapos, then, ayun po. May question po ba kaya? Okay, so, kung wala po, dito po nagtatapos yung ating demonstration po. So, thank you for your participation po, sir.
Prior to performing the assessment, introduce self and verify the client identity using agency protocol. Explain to the client what you are going to do, why it is necessary and how to participate. Discuss how the result will be used in planning further care or treatments. Perform HANA.
For classification lang po, what is your name po? Precious Alberto. How about naman po your age? 19. Your birthday naman po, June 7, 2005. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide client privacy. Inquire if the client has any history of the following. Ma'am, do you have a heart disease po? Wala naman po. How about naman po sa high cholesterol? Wala na naman po. Doon po, mag-proceed na po tayo sa ating gagawing procedure.
Simultaneously inspect the palpate the precordium for the presence of abnormal pulsation, lifts or hips. Locate the valve areas of the heart. Auscultate the heart in all four anatomic sites: aortic, pulmonic, tricuspid, and apical. Auscultation need not be limited to these areas. The nurse may need to move the stethoscope to find the most audible sounds for each client.
Palpate the carotid artery using extreme fusion. Inspect the jugular veins for distension while the client places the end of semifowler's position. with the head supported in the small pillow.
Prior to perform the assessment, introduce self and verify client's identity using agency protocol. Explain to the client what you are going to do, why it's necessary, and how to participate. Discuss how the result will be used in further planning, care, or treatment. So, good morning po ma'am. My name is Kira Pineda. I'm your nurse for today. I'm going to assess your peripheral vascular system. Perform hand hygiene. Provide client privacy. Inquire if the client has any history of the following. Ma'am, may family history po ba kayo ng heart disorders? Arterial disease po. Hypertension. Lifestyle habits such as exercise. Smoking po. Umiinom po ba kayo ng alcohol? Okay po, yun lamang po. Palpate the peripheral pulses on both sides of the client's body individually, simultaneously except the carotid pulse, and systematically to determine the symmetry of pulse volume. If you have difficulty palpating some of the peripheral pulses, use a Doppler ultrasound stethoscope. Inspect the peripheral veins in the arms and legs for the presence of appearance of superficial vein when limbs are dependent and when limbs are elevated. Assess the peripheral leg veins for sign of phlebitis. So, inassess ko naman po kanina and wala naman po akong nakita. Inspect the skin of the hands and feet for color, temperature, edema, and skin changes. Press at least one nail and pad on each hand and put between your thumb and index finger. Release the pressure and observe how quickly color returns, less than 2 seconds. And inspect the fingernails for changes indicative of circulatory for finding symmetry, pulse, volume, independent position, presence of distension and nodular bulges at calves, and symmetry inside. So, yun lamang po. Thank you po sa cooperation.
Inspect the abdomen for skin integrity. Inspect the abdomen for contour and symmetry. Observe abdominal movements associated with respiration, peristalsis, or aortic pulsations. Auscultate the abdomen for vowel sounds, vascular sounds, and peritoneal friction. Rubs warm the hands and the stethoscope diaphragm. Percuss several areas in each of the four quadrants to determine presence of tympani and dullness. Use a symmetric pattern. Begin in the lower right quadrant, proceed to the upper right quadrant, the upper left quadrant, and the lower left quadrant. Perform light palpation to detect areas of tenderness and muscle guarding systematically. Explore all four quadrants. Ensure the client's position is appropriate for relaxation of the abdominal muscles and warm the hands. Palpate area above the pubic symphysis if the client's history indicates possible urinary retention.
Prior to performing the assessment, introduce yourself and verify the client's identity using agency protocol. Discuss what are you going to do, why it's necessary, and how to participate. Discuss how the result will be used in further care treatment. Perform an hygiene, apply gloves, and observe other appropriate infection procedure. Provide a client privacy. Inquire of the following. Itanong po natin sa pasyente kung anong edad po siya nilatnan. Itanong po natin sa kanya kung gaano po kalakas at kung regular po siya o irregular. Itanong po natin ang kanyang LMP o last menstrual period at kung siya po ba ay may anak na. Kung sakali po may anak po siya, patanong po natin kung may labor, kung normal po ang kanyang labor or abnormal. Itanong po natin kung may chance po ba siya po ay idadala ng disease or sexually transmitted disease. Cover the pelvic area with a sheet or drape at all times when the client is not actually being examined. Position the client supine. Inspect the distribution, amount, and characteristic of pubic hair. These are the normal findings and deviation from normal. Inspect the skin of the pubic area for parasites, inflammation, swelling, and lesions. To assess the pubic area adequately, separate the labia majora and labia minora. And these are the normal findings and deviation from normal. Inspect the sclerotis, urethral orifice, and vaginal orifice when separating the labia minora. These are the normal findings, 2 deviation from normal. Palpate the inguinal lymph nodes. Use the pads of the fingers in a rotatory motion, noting any enlargement or tenderness. These are the normal findings, 2 deviation from normal. Remove and discard gloves. Perform hand hygiene. Lastly, document the findings. Thank you for watching.
Inspect the muscles for size. Inspect the muscles and tendons. Client turns the head to one side against the resistance of your hand. Repeat with the other side. Client shrugs the shoulders against the resistance of your hands. Client holds arm up and resists while you try to push it down. Client fully extends each arm and tries to flex it while you attempt to hold arm in extension. Client flexes each arm and then tries to extend it against your attempt to keep arm in flexion. Client spreads the fingers and resists as you attempt to push the fingers together. Client grasps their index and middle fingers while try to pull the fingers out. Client is supine, both legs extended. Client raises one leg at a time while you attempt to hold it down. Client is in same position as for hip abduction. Place your hands between the knees. Client brings the legs together against the resistance. Client is supine, both knees bent. Client raises while you attempt to straighten the legs. Inspect the skeleton for structure. Palpate the bones to locate any areas of edema or tenderness. Inspect the joint for swelling. Palpate each joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. Assess joint range of motion. The muscles are equal size on both sides of body and no contractures. No swelling, no tenderness, joints move smoothly.